An adult medical assessment typically includes the following components: medical history, warrant, current medications, past medical history, family history of diseases, allergies, lifestyle factors, diet, exercise, alcohol, smoking, physical examination, vital signs, blood pressure, heart rate, temperature, general appearance, examination of systems, cardiovascular, respiratory, gastrointestinal, neurological, etc. Laboratory tests, blood tests, complete blood count, metabolic panel, lipid profile, urinalysis, other SP. A pediatric assessment involves evaluating a child's physical, emotional, and developmental health. It typically includes Chapter 1. History taking. Gathering information about the child's medical history, family history, and social factors. 2. Physical examination. Assessing growth parameters.
A pediatric head examination assesses the child's head, face, and neurological status. Key components include inspection, observe for shape, symmetry, and any abnormalities, e.g., craniosynostosis, asymmetry. Check for any signs of trauma or swelling. Palpation, feel the skull for any irregularities.